Rationale for midterm quiz number 2. Number 1, you were asked which of the following is or are not a catecholamine. For letter A, isoproterenol, letter B, adrenaline, C, norepinephrine, and D, dopamine, these are all considered catecholamines. Only that norepinephrine, adrenaline or epinephrine, and dopamine are the natural ones, natural, or the biogenic amines, while isoproterenol is a synthetic catecholamine. Number 2, the following statements describes epinephrine except. So which of the following statements do not describe epinephrine? 1, it is an endogenous catecholamine with strong affinity to all adrenergic receptors. Adrenergic receptors, 'di ba, include alpha 1 and 2, beta 1 and 2. Now, for epinephrine, it has only affinity towards alpha 1, beta 1, and beta 2. No affinity towards presynaptic alpha 2 receptor. Therefore, this is an incorrect statement. 2, it is the only natural biogenic amine with affinity to beta 2 receptor. That is correct. Dopamine and norepinephrine has no affinity towards beta 2 receptor. 3, it is recommended to administer orally. This is another incorrect statement about epinephrine because recall, epinephrine is a catecholamine and we all know based on structure, kapag may catechol yung structure ng biogenic amine, that is a very susceptible compound towards COMT, which is present in the liver. Therefore, it is not advisable to administer catecholamines orally because they will undergo extensive first pass effect, rendering the drug useless. So the answer for this item is letter D. 1 and 3 are the exceptions or the incorrect statement about epinephrine. Number 3, based on structural features. Which of the following agent does not belong to orally administered sympathomimetics? Okay, in short, which of the following are catecholamines? Okay, kasi catecholamines, they are not orally administered. Okay, so that would be epinephrine. Okay, the rest are non-catecholamines. Next, a male patient wishes to purchase an OTC drug for colds. Okay, so meaning these are alpha 1 agonist. Now, which of the following data you gathered during the initial interview of the patient should prevent you from dispensing the medication? 1, the patient is currently taking nebivolol for his hypertension. Nebivolol, this is considered a cardioselective drug. Okay, particularly this cardioselective drug has a miscellaneous action. Particularly, it enhances the release of nitric oxide. Nitric oxide is an endogenous vasodilator. This is an endogenous vasodilator. That is why this can be used as anti-hypertensive. Anti-hypertensive. Now, if a patient wishes to use OTC drug for a long term for colds, example alpha 1 agonist, recall alpha 1 agonist has vasoconstricting action. So that contradicts the action of the drug nebivolol. Next, the patient has been exposed to cocaine. Recall that cocaine enhances the release of norepinephrine. Okay? Or yung ultimate result niya is that it enhances the level. Okay? It enhances the level. Yung ultimate net effect ng cocaine is enhances the level of norepinephrine levels, okay, in the cleft. Therefore, positive sympathetic effect yung mafe-feel ng patient kapag positive sympathetic effect, that would enhance also vasoconstriction. Okay, so that is another data that you need to consider upon dispensing OTC drug for colds with vasoconstricting action, because that might enhance the effect of the initial drug that has been taken. Example, cocaine. Three, the agent is an elderly with a history of urinary hesitancy. So yung patient, eh, hirap na sa kanya umihi. Therefore, you have to consider this data as well. Okay, with long-term use of alpha-1 agonist, that might prolong, no, or cause extensive urinary intermittency for that patient. Okay, so all of the above must be considered. Next, in which of the following clinical conditions are the agonists of beta 1 adrenoceptors found to be useful? We all know that beta 1 adrenoceptor is present in the heart. Okay, present in the heart, in which activation of beta 1 receptor enhances the strength of contraction of the heart, that is inotropy, positive heart rate, that would be chronotropy, and positive dromotropy. So among the choices, what is related to the heart is 3. So the answer is 3 only. Okay, very good po yung beta 1 agonist for bradycardia. Knowing that beta 1 agonist enhances heart rate, okay, thus it can manage bradycardia. Next, which of the following adverse effects can be attributed to clonidine? Clonidine, recall this is a presynaptic alpha 2 agonist. A presynaptic alpha 2 agonist. You have your notes already for the adverse effects of clonidine, and take note, it is known to cause a rebound hypertension. Okay, rebound hypertension, this causes upon abrupt withdrawal of clonidine. That is why, as a remedy, if the patient decides to discontinue already the clonidine maintenance, then it has to be gradually discontinued. Okay? Hindi yung abrupt na i-withdraw mo yung take ng clonidine. So it has to be gradual, okay? Slowly, hinay-hinay nga reduce sa dosage ng clonidine. Okay? Para maiwasan yung rebound hypertension. Next, a given adrenergic agent induces uterine smooth muscle relaxation. So which of the drug um, could have this attributed effect? So sino dito yung may yung drug na may action towards beta 2? Okay, beta 2 receptor. Sino dito yung may action towards beta 2 receptor as tocolytic? Okay, as tocolytic agent. So we have Rytodrin. Another drug is isoxaprine. Next, which of the following is or are consistent with the systemic use of drug clonidine? Okay, with systemic use of clonidine as an antihypertensive agent, it has a long-lasting na effect, and that is lowering of the BP. Okay, take note, this is a presynaptic alpha 2. Okay, presynaptic alpha 2 agonist. Recall, activation of presynaptic alpha 2 receptor causes auto regulation. Okay, so you know already what would be the effect. That would be negative sympathetic effect. That's pwede siya for lowering blood pressure. Okay, actually yung merong initial na transient effect yung clonidine. And it has to be uh, increase in BP. Yun yung initial. Okay, initial niyan. Then later on, yung body natin magko-compensate for that initial increase in blood pressure. Thus, ang lasting effect na dayon upon compensation ng body natin is lowering of the BP. Okay? So, letter B is only the correct answer. Kasi dapat sa Roman numeral 1, it has to be initial transient increase in blood pressure level. Next, epinephrine is considered as the first line for the management of anaphylaxis and anaphylactic shock. Anaphylaxis and anaphylactic shock. Which of the following explains the MOA of epinephrine in anaphylaxis and anaphylactoid um, shock? Okay. So letter uh, 1, inhibition of allergic reaction by beta 2 receptor agonist. We all know that anaphylaxis, anaphylactoid shock, yung common sa kanila na pwedeng i-manifest ng patient due to allergic reaction is yung difficulty of breathing. Okay, difficulty of breathing. Yan yung common sa kanila, difficulty of breathing. So as a result, I mean, as um, with this, no, in connection with this, epinephrine, knowing that it has affinity towards beta 2, it has ability to activate beta 2 receptor, pwede siya gamitin to dilate the bronchioles. Okay? Another, 2 alpha 1 activation leading to vasoconstriction. Recall that another common manifestation ng patient with anaphylaxis anaphylactoid shock is hypotension. Okay? So, mababa yung blood pressure. Okay, so with epinephrine, meron din siyang affinity towards alpha 1. Okay, it can activate alpha 1, and remember alpha 1 is a GQ, a linked receptor, so constriction, may vasoconstriction. Thus, pwede niyang i-manage yung hypotension. Okay, napapataas yung BP with vasoconstriction. And yung 3, related lang yun sa 1, beta 2 activation leading to bronchodilation. Okay. So again, 1, 2, 3. This explains the MOA of epinephrine during anaphylaxis reaction. Okay, tandaan nyo lang about anaphylaxis, anaphylactoid. Um, ang common sa kanila is difficulty of breathing, hypotension. Yung nagkakaiba lang sa kanila is yung source ng allergic reaction. Anaphylaxis, ito yung normal. Okay? This is IgE mediated, immunoglobulin E mediated, whereas anaphylactoid, this is caused by a drug. Okay? So, non-IgE mediated yung anaphylactoid shock. Next, the activity of this drug as local vasoconstrictor makes it a good combination with a local anesthetic during dental procedures. We all know that the common local anesthetic administered during a dental extraction is lidocaine. Okay, and a very good local vasoconstrictor, which is a good combination for lidocaine, is epinephrine. Again, that is because of its vasoconstricting action for epinephrine. Next, which of the following beta blockers is most likely useful for patients with acute heart failure? Again, which of the following beta blockers is most likely useful for patients with heart failure? Heart failure. Now, recall that beta blockers, pili lang yung ginagamit natin for heart failure. Again, pili lang yung mga beta blockers na ginagamit for heart failure, and you have it in your notes. And that includes nebivolol. Okay? Next, as an inotropic agent, norepinephrine has been shown in some small clinical trials to be most useful in which of the following conditions? So norepinephrine, yung nasa notes nyo, it is a first line in the management of septic shock. Next, which of the following statements are true regarding the drug methyl-dopa? So methyl-dopa, again, this the same with clonidine. This is a presynaptic alpha 2 agonist. So very good for the management of hypertension. So that is one. Another, with regards to their adverse effect, okay, it causes positive Coombs test. Okay. Coombs test. So, positive yung Coombs test, ibig sabihin, with methyl dopa, napapatas na yung antibody that breaks the RBCs. Okay? That damage RBCs. Kaya nagkakaroon ng hemolytic anemia. And also with toxic doses of methyl dopa, nasa notes nyo, included sa adverse effects, this is an hepatotoxic agent. So 1, 2, 3, true about methyl dopa. Next, what are known clinical uses of beta 2 agonists? Beta 2 agonists, beta 2 agonists, beta 2 receptor is present in the uterine smooth muscle. Activation of beta 2 receptor causes relaxation of uterine smooth muscle. That is why pwede siya for the management of premature labor. Beta 2 is also found in the skeletal muscle cell membrane, causing uptake of potassium, thus leads to hypokalemia. Kaya pwede siya in the management of hyperkalemia. Kasi nga ulit, napapababa niya yung level ng potassium ion sa blood, thus managing hyperkalemia. And we also have beta 2. Take note, beta 2 receptor in the bronchial smooth muscle. So pwede siya for the management of bronchial asthma. So all of the above. Next, which of the following agents is classified as a selective direct acting beta 2 agonist? Again, selective lang sa beta 2 agonists. So we have isoxaprine, which is a tocolytic. Okay, this is a tocolytic. It relaxes the uterine smooth muscles. Propranolol, this is a non-selective beta blocker. Methoxamine, this is an alpha. Okay, alpha agonist. Okay, prazosin is an alpha blocker. Okay, then we have ephedrine, which releases, no, enhances the release of norepinephrine. Next, which of the following blockers of alpha 1 adrenoceptors most likely useful for elderly male patient with PPH? So among the following, tamsulosin is the most commonly used for those elderly patient diagnosed with PPH because it helps ease the urination of the patients with enlarged prostate gland. Next, among the potential effects of epinephrine, which of the following is most accepted indication? Again, I repeat, nowadays, epinephrine, yung pinaka most useful application niya is for dental extraction. Okay, so ginagamit siya for combination with lidocaine because of its local vasoconstricting effect. Next, which of the following agents or are age which of the following is or are agents that selectively targets alpha 2? Okay, so which of the following has affinity towards alpha 2 presynaptic neurons? So all of the above. Okay, methyl dopa, clonidine, and guanabens. These are all um, alpha 2 receptor agonists. Next, which of the following is the clinical indication of the drug phenoldopam? Phenoldopam is a dopamine 1 agonist. Okay, and activation, stimulation of dopamine 1 receptor that induces renal vasodilation. Thus, with renal vasodilation, di ba, na-enhance niya yung diuresis na ngayon yung blood volume. Okay? Yung blood volume. Blood volume. And with that, kapag decrease yung blood volume, na-decrease din yung, that decreases the, ayan, blood pressure ultimately. Okay? Kaya, phenoldopam is also classified as an antihypertensive. Next, which of the following adrenergic agents is or are most useful for hypodynamic septic shock? Okay, for septic shock, diba, we have norepinephrine. Now, with hypotension caused by heart failure, that has something to do with cardiogenic shock. Wherein this is usually a manifestation with for those patients with heart failure. Diba? Decrease yung ability nila to contract. Okay, so a good drug, or most useful drug for these conditions Septic shock with hypotension caused by heart failure is norepinephrine and dopamine. Next, correct statements about dipivefrin. Dipivefrin is a prodrug of epinephrine. Okay, para saan siya? It is used in the management of glaucoma. So, 1 and 2 only. Kasi yung first line, cardiac stimulant is epinephrine. Next, guanfacine, guanabens. Yeah, these are agonists for presynaptic alpha 2. What else? What are the other agonists of alpha 2 receptors? Presynaptic alpha 2 receptor, di ba? We have methyl dopa and clonidine. Next. Uh, Next, we have drug that stimulates beta 1 receptor. Again, drug that stimulates beta 1 receptor, we have dobutamine. Okay? Dobutamine, this is a beta 1 selective agonist. Next, a patient complains of muscle weakness after several doses of salbutamol. Salbutamol is a beta 2 agonist. Okay, very good for asthma. Now, this weakness due to several doses of salbutamol can be attributed by, yes, that's letter A, hypokalemia. Kasi yung nangyayari with salbutamol, di ba, the blood compartment, from the blood compartment, this is the blood, this is the skeletal muscle compartment. Mula sa blood, there is an uptake of potassium, okay, into the skeletal muscle cell membrane. So, yung nangyayari, with potassium ions in the skeletal muscle that induces contraction kaya nagkakaroon ng tremors, okay, that leads to tremors, and later on darating yung time na mapapagod yung skeletal muscles natin with extensive contraction leading to muscle weakness. Okay. Next, which of the following beta blockers also has peripheral vasodilating effect similar to prazosin? So we're talking about beta blockers na merong vasodilating effect. Prazosin is an alpha blocker. Diba? Basta ending in zosines, alpha blocker. Ending in zosine, alpha blockers. Okay? Now, we have beta blockers with miscellaneous action. Aside from blocking beta receptors, meron silang other effect that makes them very good clinical applications. Now, example of a beta blocker with vasodilating effect with upon blocking alpha 1 receptor is labetalol. Okay? Also carvedilol. Okay, carvedilol and labetalol, beta blockers sila, wherein isa sa mga miscellaneous other action nila is to dilate the blood vessels because they have that ability to block as well alpha 1. Next, which of the following beta blockers is considered cardio selective? Cardio selective na atay mnemonics ani, di ba? Beam. Beam. Tingnan niyo yung notes nyo. Beam. Okay? So, included doon yung esmolol. Cardio-selective, those are beta 1. Beta 1 selective. Beta 1. Kasi nga, bakit beta 1 selective? Cardio-selective sila. Okay, beta 1 selective nga agonist. Kasi, nasaan ba yung beta 1? Beta 1 receptor is present in the heart. Okay? This is not agonist, it's antagonist. Sorry. Antagonist. Kasi ulol. Next, which of the following beta blockers has least likelihood of inducing membrane stabilizing action? So, least likely. So, exception dito. Walang ability to induce membrane stabilizing action. That would be timolol. The rest of the beta blockers listed, they have that miscellaneous action to induce membrane stabilizing action. Next, beta blockers not associated with vasodilating effect. So, none of the above. Kasi all of the above, meron silang miscellaneous effect, which is vasodilation. Yung first two, carvedilol and labetalol, yung vasodilating effect nila is associated upon blocking alpha 1. No? Blocking alpha 1. Nebivolol, meron siyang vasodilating effect because it enhances the endogenous vasodilator in the body, and that is nitric oxide. Nitric oxide again is an endogenous vasodilator. Next, in which of the following conditions are non-selective alpha blockers found to be useful? Again, non-selective alpha blockers found to be useful. These are used for initial therapy in pheochromocytoma. Next, the following is or are significant adverse effects associated with alpha 1 blockers. Associated with alpha 1 blockers except, okay? So, yung hindi related, hindi side effect ng alpha 1 blocker. First dose effect, this is a very common, no? This is a very common adverse effect by alpha 1 blockers, including reflex tachycardia. So, yung hindi kasali dito yung extrapyramidal effect. So, 2. Next, the following agonist agents do have affinity towards beta 2 adrenoceptors, except, so dobutamine yung exception, kasi dobutamine is only beta 1. Okay? Beta 1 agonist lang siya. Selective lang siya. Selective siya towards beta 1 agonist. Beta 1 receptor. Next, which of the following drug is considered to be agent of choice, drug of choice, agent of choice for anaphylaxis? No, anaphylactic attack, anaphylactic shock. So anaphylaxis, dumdumi, epinephrine. Again, drug of choice for anaphylaxis, okay, is epinephrine. Next, which of the following agent associated with nasal decongestant effect? Nasal decongestant effect, obviously 1 and 2. Di ba 1 and 2? These are a common component sa mga nasal decongestants that can be purchased over the counter. Examples of phenylpropanolol, this is present in Decolgen. Phenylephrine, present as a Nuzep. Rytodrine is, this is not an alpha agonist. Okay, Rytodrine, this is a beta 2 agonist. Next, the following is are beta blockers which manifest affinity towards beta 1 adrenoceptors, except, okay? So, exception dito, yung walang affinity, none of the above. Okay, lahat nito, lahat ng nasa choices, merong affinity towards beta 1 receptor. Okay, next, which of the following beta blockers is or are classified as cardioselective agent? All of the above. Metoprolol, nebivolol, acebutolol, cardioselective sila. Cardioselective. Nebivolol is the most cardioselective one. Most cardioselective beta blocker. Metoprolol, acebutolol, these are beta 1 selective agonists. Next, which of the following includes the common adverse effects of catecholamines? Okay, related to alpha receptor actions. Again, common adverse effects ng catecholamines related to alpha receptor action, that is digital necrosis. Recall that alpha receptor, di ba, ilahang pinaka-common yun nga adverse effect that is related to thermo-wise vasoconstriction. Now, because of that vasoconstriction, naapektuhan yung mga blood vessels supplying blood to our digitals, no, sa ating fingers. Okay, that will cause a lesser blood supply sa kuko, causing digital necrosis. Next, the following agents can be classified as indirect acting sympathomimetics, indirect acting, except none of the above. Okay? Kasi all of the above are indirectly acting sympathomimetics. Next, which of the following beta agonists are clinically useful to patients with COPD? So obviously it's 1 and 3. Salmeterol and formoterol, these are beta 2 agonists. Okay, these are beta 2 agonists, particularly these are LABAs, long-acting beta 2 agonists. The butamine, it has nothing to do with um, the beta 2 in the bronchioles. Okay, this is more on beta 1 receptor agonist. Next, which of the following statements describes the importance of combining epinephrine with lidocaine in a solution for dental extraction? Recall that epinephrine is added or combined with lidocaine during dental procedure. Una, to minimize bleeding. because of its vasoconstriction effect. So that minimizes bleeding. Another is to enhance local anesthesia. Okay? Para mas accumulated yung lidocaine, yung local anesthesia on the site of the gums kung saan bubunutin yung ngipin. Two, this is very contradicting. Kasi epinephrine, it cannot dilate the blood vessels. Instead, remember, it is a local vasoconstrictor. Okay? So, 1 and 3 only. Next, a common adverse effect related to actions of beta 2 agonists. Yeah, that includes letter A. Recall, beta 2 is present in skeletal muscle cell membrane that causes uptake of potassium ion. Okay, and with too much potassium ion in the skeletal muscle that causes tremors, and later on, with tremors with extensive contraction, muscle weakness will occur. Next, the following is are true statements about selective alpha 1 blockers, except. So, except, hanapin natin yung exception related to selective alpha 1 blockers. So, una, it is used to ease urination among men. Okay, this is actually a true statement for selective alpha 1 blockers. Okay, ginagamit sila for those patients with BPH na hirap umihi. Same with 3. Because of their vasodilating effect, pwede talaga sila to ease urination for men with BPH. But Roman numeral 2 is the exception here. Okay? Yan yung exception dito. Kasi vasodilating, vasodilators lang yung mga alpha 1 blockers. Wala silang effect towards the enlargement, yung paglaki ng prostate gland ng men. Okay? Yung uh, gamot for the enlargement ng prostate gland, it has something to do with the hormones na. So, kailangan na ng mga hormonal um, a replacement, hormonal replenishments. Next, beta blockers that are classified as cardioselective agent may be clinically used for, it's all of the above. Okay, kapag cardio-selective ang isang gamot, example, beta blocker, pwede siya for those um, for those conditions that is related to the heart. In fact, beta blockers are classified as class 2 anti-anginals. Okay? They can be used for the management of angina, yung chest pain. Okay, meron din tayong beta blockers for hypertension, and we have selected beta blockers for congestive heart failure. Okay, so we have apat. Okay, next, the group of patients who are not advised to take non-selective acting beta blockers include, that's one only, no? So 3, this should be hyperkalemic. Hyperkalemic. So I will consider those answers na 1 kasi dapat 1 yung sagot dito. Okay? So 1. Mali yung na-input ko na sagot. Should be only 1. Okay, not advised. Kailang condition, kailan na cases or condition bawal, no? Hindi pwedeng gamitin yung non-selective beta blockers. Kapag sinabing non-selective beta blockers, pwedeng mag-block sa beta 1, pwedeng mag-block sa beta 2. Now, kapag na-block yung beta 2, that causes bronchoconstriction. So, bawal siya for those patients with asthma. No? And blocking beta 2 actually causes um, it can actually cause hyperkalemia. Okay? Oh, wait. This is correct, no? Tama pala yung letter D. Okay, tama yung letter D. Okay? Correct. I-correct na to, ha? Tama yung letter D na sagot. Okay? Tama, tama, tama. Okay? Blocking. If we block the beta 2 receptor, that will cause hyperkalemia. So, pwede siya for the management of hypo. Not advised. Not advised, no? Not advised, not advised. So, tama nga. A lang po, A lang. Okay? A lang. So, final answer, letter A. Not man, not advised. So, nadeglect natin yung not advised. So, kailan hindi pwedeng gamitin yung beta blockers that can also block beta 2. Okay? So, non-selective beta blockers, pwede siya for hypokalemic patient. Again ha, balik ko na to. For number 43, yung tanong, group of patients not advised to take non-selective beta blockers. So, only asthmatic patient. Kasi, upon usage of non-selective beta blockers, that will um, cause extensive bronchoconstriction. So may bronchoconstriction na nga yung asthmatic patient, imo pagid siyang tagaan og non-selective beta blockers mo samot no ang bronchoconstriction. Sa Roman numeral 2, obviously this is not something related to beta blockers kasi pag elderly patient with BPH, alpha blocker yung kailangan, alpha blocker yung kailangan. Now, 3, patients with hypokalemic agent, pwede. 'Di ba? Pwede yung non-selective acting na beta blockers. Okay? Knowing na kapag block natin ha, kapag na-block yung beta 2, instead nga hypokalemia, hyperkalemia. Okay? 'Di ba? Hyperkalemia, napapataas niya yung potassium ion level in the blood. So, pwede niyang ma-manage. No? Pwede niyang ma-manage for ang condition na hypokalemia. Kasi pag hypokalemia, mababa yung potassium ion. So, upon blocking beta 2, napapataas nyo yung potassium ion level. Okay? So, pwede dapat. Okay? So, yung tanong man is not advised, so one only. Okay? So, one only yung sagot. Next. Which of the following agents are general inhibitors to the normal physiologic release of norepinephrine from presynaptic vesicles? It's only A and B. Kasi yung guanabens, it has something to do with stimulating presynaptic, ayan, alpha 2 receptor. Okay? Guanabens, it stimulates presynaptic alpha 2 receptor. The rest, guanadrel, guanethidine, these are peripherally acting na blockers ng norepinephrine release. Next. Uh, Identify if the given chemical structure of a compound below is a catecholamine or a non-catecholamine. So, given the structure na merong benzene ring, kapag sinabing catechol, di ba, catechol is a dihydrobenzene. So, dapat meron kang makita na benzene ring with adjacently attached na OH. That makes it dihydroxybenzene, making it catecholamine. Okay, so in this example, yung benzene ring has only one hydroxy attached to it. So this is a, a non-catecholamine. Again, 45 is non-catecholamine.